Welcome to the third video in the vascular simulation program. This will look at the parachute technique, which is another way to begin an arterial anastomosis. It can be particularly helpful to make sure you get good bites around the heel when the artery is deep in tissue. You should have everything you need, including a new artery and vein model. This can be performed without an assistant, as shown in this video, but it can be easier to have someone to follow to stop your sutures getting tangled. Make an arteriotomy in the usual fashion with an 11 blade. Extend with scissors in both directions. Again, you may find it easier to excise a small ellipse from the arterial model. Shape the end of the graft as shown in the previous video. Begin by taking a bite through the vein from outside to in. Then take a good full thickness bite through the arterial wall from inside to out. Note how the sutures are slightly offset from the apex. Pull the suture through so that both ends are roughly equal. Take the next bite through the vein from outside to in. This should be placed on the side nearest to the artery. You can use your forceps inside the vein to help keep it steady. When using a real vein, this can also help to keep it open. Take a bite through the arterial wall from inside to out, to come out near the first stitch, but on the side slightly closer to the vein. Continue to take bites through the vein from outside to in, with each bite coming round the heel on the side closest to the artery. Pull the suture most of the way through, leaving a short length between the vein and artery. You can also use your forceps inside the vein to place some tension on the sutures as you take a bite through the artery. This can help you see where your previous stitch is and help prevent your sutures from becoming tangled. Take care not to lock your suture, otherwise you'll have to start again from the beginning. You can see how the suture begins to resemble the strings of a parachute. Once you've taken at least 3 bites through both the vein and the artery, place that needle in a rubber shod. Begin with the other needle. This time, come through the vein from outside to in on the side furthest away from the artery. Then, take a bite through the artery from inside to out on the side furthest away from the vein. Remember to position your needle so you're always coming through at 90 degrees to the vessel wall. Use the curve of the needle to drive it through. Before you slide the graft into position, make sure the model and sutures are well lubricated. Pick up both sutures in one hand and hold the graft in the other. Gently pull the sutures, then gently pull on the graft. Do this in an alternating fashion so the graft slowly slides down into position as the sutures tighten. Try to use small motions rather than one big pull. Once the graft is in place, you can also pull the sutures at right angles to the artery to make sure they are tight. Now you can complete the rest of the anastomosis as shown in the previous video on end-to-side anastomosis. This is the finished anastomosis. You can see the sutures are evenly placed and the suture line is everted. For further information, to ask a question or leave a comment, remember to visit vasimulation.co.uk or email vasimulation@gmail.com.